Hello, my name is Natalie Anderson, and I'm a student at Lamar University. I would like to welcome you to my Capstone and 5-year plan. This is for my nursing course, 4580, Synthesis of Professional Nursing. Prior to becoming a registered nurse, I worked as a licensed practical nurse for 6 years. I graduated from Lamar State College, Orange, during the fall of 2004 with my associate degree in nursing. My work experience consists of long-term care and mental health inpatient and outpatient services. I have 20 years experience in working with older adults with behavioral health issues. I have an anticipated graduation date of December 14, 2018 from the RN to BSN online baccalaureate program through Lamar University. Several learning outcomes were met throughout the program. The first learning outcome listed in the Lamar University Joanne Dishman School of Nursing is Humanity and Society Construct. It involves practicing safe and effective holistic patient-centered care to a variety of patients in multiple settings from a global perspective by incorporating theories and evidence-based findings. This learning outcome was met by completing the Civic Pride and Diversity PowerPoint on Volunteers of America. Also by completing the Community Practicum project planning, which involved in assessing how a disaster would impact the daily activities and healthcare needs of the community. And also the Global Health Assessment, which was completed on tuberculosis. It involved researching and discussing the nature of the problem, prevalence, incidence, contributing factors, and the impact efforts of the World Health Organization. The nursing course was 4540, Care of Communities. The outcome met was at 96%. The second learning outcome is Lifespan Health Continuum Construct. It involves supporting patients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity. The assignment was comprehensive health assessment and documentation, which involved demonstrating therapeutic communication and technique skills to complete a comprehensive health assessment. The course was Nursing 4316 Comprehensive Holistic Health Assessment. The outcome was met at 95.5%. The next assignment that helped me to meet this learning outcome was reading a memoir. The memoir I chose was Needles, a memoir of growing up with diabetes. Also completing the practicum reflection assignments, which involved me interviewing a patient with type 1 diabetes and developing a plan of care using current evidence-based practice. The nursing course was Nursing 4620, Care of Patients with Compromised Multiple Health States. The outcome was met at 98%. The next learning outcome is Evidence-Based Practice and Clinical Reasoning Construct, which involves synthesizing clinical reasoning and judgment and the nursing practice utilizing critical thinking, nursing process, research, and evidence-based practice. The course was Nursing 4390, Nursing Inquiry and Evidence-Based Practice. The assignment I did was research and critique a quantitative research article. The outcome was met at 92%. The next learning outcome was Patient-Client-Centered Care, which involves employing safe, effective, patient-centered care using theories and evidence-based findings in collaboration with patients and members of the interpersonal and intraprofessional healthcare team. The assignments that helped me to meet this outcome was the clinical application assignment and the global health PowerPoint presentation. The clinical application assignment involved identifying a current problem in my practice setting and interviewing a nurse manager about a potential policy change. This assignment involved meeting with staff to assess their perception of the potential policy change and researching current evidence-based practices associated with the policy change. The potential policy change I chose was medication reconciliation in behavioral health care settings. For the Global Health PowerPoint presentation is where I identified the International Society of Psychiatric Mental Health Nurses as a global professional organization that I would like to become a member of. The nursing course was Nursing 4550, Nursing Practice, Leadership, and Management in the Healthcare System. The outcome was met at 94%. The next learning outcome is Professional Roles Construct. This involves differentiating multiple role dimensions and practices within ethical, legal, and regulatory parameters when caring for patients as a member of the interprofessional and intraprofessional healthcare team. The course was Nursing 4321, Nursing Theories and Online Education. The assignment was the Differentiated Essentials Competency, Formal Assignment, and the Philosophy APA paper. The outcome was met at 93%. The differentiated essential competencies involve researching and discussing legal and ethical issues applicable to the scenario of a patient falling in the hospital and sustaining a fractured femur while in the care of hospital staff. The philosophy paper involved me exploring my own philosophy of nursing and comparing my view with theorist Betty Newman. Next is demonstrating professional integrity, effective communication, active inquiry, and service to the community. The course was Nursing 4540, Care of the Communities. The assignment was the project teaching plan. The project teaching plan was completed on disaster preparedness for community members with multiple chronic medical and physical illnesses. The outcome was met at 100%. My 5-year plan involves me furthering my education, which will give me the skills, resources, and knowledge needed to meet the needs of my organization. I would like to continue my career in mental health nursing and provide care for persons with mental illness. I plan to enroll in a master's program at the University of South Alabama from fall 2019 to fall of 2021. My goal is to earn a Master of Science in Nursing and become a psychiatric nurse practitioner. I want to be of service to my community by being committed to the practice of psychiatric mental health nursing. My references include Lamar University, Joanne Gay Dishman School of Nursing, the undergraduate RN to BSN student handbook, also the University of South Alabama College of Nursing, Master of Science Nursing Curriculum. I would like to thank everyone for being a part of my presentation for my capstone and 5-year plan.